Hey, it's Mo Egger. The big question this football season, where are you going to watch all the big games? I've got the answer. Long Neck Sports Grill, 3 locations in northern Kentucky, Wilder, Hebron, and Richwood, each of them very easy to get to. The TV setup is unmatched, 4K TVs all over the place, and the sound is on for all the big games. You can't top the menu. I love the wings, and no place has a better beer selection. That's most important. Long Neck Sports Grill, perfect for football season. Stay late, come often. Let's chat with my new friend, Dr. Amelia Wiggins, OrthoCincy's, the folks at OrthoCincy's. By the way, the cool thing, number one, about OrthoCincy's, locations all over the place, Ohio, Kentucky, Southeast Indiana. They've got offices with very flexible hours till 9 o'clock Monday through Friday in Edgewood, Saturday 9 to 1, same for Eastgate. You don't need an appointment. Go to orthocincy.com. Dr. Wiggins, good to have you. I'm going to ask you about Drew Sample. I want to start with the Nick Senzel thing because the broken toe, pretty straightforward. I get that. But, I mean, here you have a guy who has compiled a very lengthy list of injuries that have sidelined him. Give me a clinical explanation for this. Are athletes really, a guy like Nick Senzel, clinically, can he be described as being injury prone?
Gosh, yeah. First, no, thank you so much for having me on today. I'm so excited to be talking about all this. And yes, so great question. And it's one that us as doctors too say, what is going on? Because you tend to see the repeat offenders. You know, there's always that kid on the team that just like, what are you doing?
Right.
What are you doing? But yeah, so genetics, there are a few factors that play into this. And genetics is certainly one of them, you know.
Right.
Our genes are our genes. And at least with some injuries, like ACL injuries, we have identified a genetic variant that tends to be associated with ACL tears. So if we find, you know, not many people go looking for this variant, but we've noticed in our studies that that a lot of kids that tear their ACLs do have this genetic variant, and it has to do with the way their collagen is formed. And so I think we're making advances in that area. You know, there's a lot of research going on right now, and maybe there are other genes that make these kids and professional athletes, you know, quote, a little bit more accident prone. But there's so much more behind it. I think there's, you know, the biomechanics, how are you running, jumping, throwing, landing, and then there's a lot of psychological factors too that go into an injury or being an injured athlete and recovering from an injury and having another injury. So there's a lot that goes into it. I don't know, a broken toe, that just seems like pretty bad luck. He ran into a wall, you know, that stinks. So I don't think that was related to his genetics, but certainly an interesting thought. Yeah.
Can you, if you're a professional athlete or maybe just, you know, somebody like me playing, you know, softball every week during the summertime, can you make yourself less injury prone?
Absolutely. Yes, absolutely. That's where, first of all, just getting a good night rest. These are such simple things that can really help. We do see an increased injury rate in athletes that are tired, that are overworked, and that are deconditioned. You know, so you always see a lot of injuries at the first part of the season. Then you see more injuries at the end of the season when, you know, patients are exhausted from a hard season. So staying hydrated, staying well rested, staying flexible, all of those things help prevent, especially our weekend warriors, from getting injuries. And then for your young athletes, you know, focusing on biomechanics. Are they throwing correctly? Are they jumping and landing correctly? Those are things that we can teach and you can learn as an athlete. And if you're throwing correctly, if you're jumping, landing, you can prevent ACL injuries, you know, UCL injuries in the elbow, shoulder injuries with pitchers and things like that. So let
me ask you about Drew Sample. The Bengals tight end suffered a knee injury on Sunday against Dallas, and Zach Taylor today said he's going to have surgery and will be out for months, which is obviously no good for him and the team. When the injury first occurs, it's a knee injury. What sort of things are you looking at? What sort of variables are there to determine whether or not a knee injury is something that's going to be relatively insignificant or be major enough to require surgery?
Yeah, so first, when the injury just occurs, it's always helpful to watch the game, to see the injury unfold, because it gives you a lot of clues and insight as to how severe this might be, what could have been injured on the inside, the outside of the knee. So just straight out, you know, we take in the whole joint and we take in the whole situation, and then we start to talk to the athlete. Where does it hurt? Does it hurt on the inside, the outside, the top, the bottom? You know, Does it feel unstable? Is it swollen immediately? Did they hear any pops or noises or anything like that? And then that first exam, as soon as we touch the knee, when they're on the field, we're testing the main ligaments in the knee, the ACL, the PCL, seeing how unstable the knee is going front to back, or the MCL and the LCL, seeing how unstable it is going side to side. Those are things that, we're just looking out for immediately. Any high level athlete, they need to be able to pivot, accelerate at high speeds. So if they have a ligament injury, meniscus injury, or cartilage injury, that can really compromise their entire season. So we want to rule those out immediately and then work on the rehab process.
I want to talk about something scary that happened on Monday night. I'm watching the Buffalo Bills play, and they had a player by the name of Dane Jackson who was hit by his own teammate. I saw the replay one time. I did not want to see it again. And, I mean, my first thought was obviously significant neck injury, and I'll be honest with you. I thought it might be even worse than that. And he walked out of the hospital the next day. And so, all right, so from a non-clinical standpoint, I go, boy, that's miraculous. Give me something in greater detail. How can something like that happen, and in less than 24 hours, you're walking out of the hospital with basically nothing more than a headache?
Yeah, he is so lucky. I saw that game as well when Dane Jackson went down. And, oh, my gosh, the entire stadium just stopped. I held my breath because that was absolutely a scary, scary injury, and I do hope that he does have a full and quick recovery. When Dane took that hit to the head, it was a hyperextension injury, or that spear tackle that we talk about in football, and that is such a dangerous way to get hit. That can cause significant injury to the cervical spine, to the spinal cord. What happens, that neck, it whips back like that, and that can injure the bones, the muscles, the ligaments. And sometimes it's just worse. Sometimes it's better. I think he was just very lucky. I really do, with that injury, because that could have ended up terribly. The spine is curved in such a way that it has that increased mobility to absorb the force of a hit like that. And then the helmet helps as well. But ultimately, the bones, the ligaments, the muscles, that's what's really taking on that force. And if they, don't absorb all of the force, then that force goes onto the spinal cord and the nerve roots. And that's when you start to see that lasting damage to like a spinal cord injury that could have been very detrimental.
All right, one more that I want to talk about. The San Francisco 49ers have a young quarterback by the name of Trey Lance. He suffered a broken ankle in their game this past week, and they're saying going to require surgery and is going to miss the rest of the season. Now, we're getting ready for week 3, so the most of the season is still in front of us. Walk us through the prognosis for an injury like that, and if he has the surgery now, does the rehab and recovery really take 3 or 4 months, causing him to miss the entire season?
It does. Unfortunately, he's saying, an ankle fracture dislocation. From everything that I've read, it sounds like it was, quote, a simple fracture. So it's, the bone broke clean. It didn't involve multiple pieces. It didn't involve the joint surface. It sounded like he did have a ligament repair or ligament injury with it. But that is kind of considered a simple ankle fracture. So he has a pretty good prognosis there. As far as recovery time, still needing surgery. So he's going to have to heal the fracture. He's going to have to heal those ligaments. That in itself takes about 6 to 8 weeks. And then you have to get him back to, professional athlete level status. The good thing is after surgery, his bones and ligaments will be stabilized. So he can start that physical therapy right away. He can work on regaining his motion, the strength, the balance, and even start weight bearing pretty quickly. And that'll help get him back, hopefully by the 2023 season. 10 to 16 weeks is typically the recovery on that. 10 weeks would certainly be quite early, probably more like 3 to 4 months, like you mentioned. So I don't know, about the end of this season. The timeline gets a little tight there, but I think definitely being back for the 2023 season is reasonable. And like I said, he should have a pretty good prognosis moving forward.
Hope so. I appreciate the time this afternoon, Doctor. That was awesome. Thank you.
Thank you.
All right, Dr. Amelia Wiggins, OrthoCincy. Go to OrthoCincy.com, 12 locations if you need them, and no appointment is ever necessary. They've got locations with hours in the evening till 9 o'clock and Saturday hours as well. Go to OrthoCincy.com, locations in Cincinnati, Northern Kentucky, in Southeast Indiana. All right, briefly, deep dive into the Bengals pass protection issues and Brenneman and Jones on baseball next. Hey, it's Mo Egger. The big question this football season, where are you going to watch all the big games? I've got the answer. Long Neck Sports Grill, 3 locations in northern Kentucky, Wilder, Hebron, and Richwood, each of them very easy to get to. The TV setup is unmatched, 4K TVs all over the place, and the sound is on for all the big games. You can't top the menu. I love the wings, and no place has a better beer selection. That's most important. Long Neck Sports Grill, perfect for football season. Stay late, come often.